Imagine finally solving one major worry. Then another immediately replaces it. You worry about work and money. Then health becomes the next problem. Then something involving your family appears. Eventually, you're worrying about your worrying. Anxiety itself is completely normal. It's your brain's built-in alarm system. It prepares you for possible danger. Your heart begins beating much faster. Your muscles tense without asking permission. Your attention starts searching for threats. Normally, the alarm eventually turns off. But with generalized anxiety disorder, that alarm can remain constantly active, sometimes for months at a time, even without one obvious threat nearby. The worries become difficult to control, and constantly anticipating problems becomes exhausting. Your body pays a price too. Muscle tension and restlessness can appear. Sleep may become surprisingly difficult. Fatigue can follow you everywhere. This isn't simply worrying too much. It's an alarm struggling to switch off. Panic disorder. Now imagine that same alarm system, going from 0 to maximum instantly. Before you even understand what's happening, your heart suddenly begins pounding hard. Breathing becomes difficult or uncomfortable. You might shake or feel dizzy. Your chest may suddenly feel tight. Sweat can appear almost instantly too. The sensations feel intensely physical. So your brain searches for explanations. Something must be terribly wrong. Maybe you're having a heart attack. Maybe you're about to pass out. Maybe you're actually about to die. That's what panic can feel like. But one attack isn't panic disorder. The disorder involves recurring panic attacks. Then, another problem often develops. You become afraid of the next one. Maybe you stop taking crowded trains. Maybe busy stores suddenly feel dangerous. Certain places become harder to visit, especially places difficult to escape quickly. Your world can gradually become smaller because fear changes your daily decisions. Eventually, fear of another attack can become its own powerful trigger. Major depressive disorder. Depression is often described as sadness, but sadness is only one piece. Imagine waking after 8 hours of sleep, yet you still feel completely drained. Your favorite show hasn't suddenly changed. Your friends are still themselves too. Food might taste exactly the same, but something important feels strangely missing. Things stop producing the same reward. Psychologists call this lost anhedonia. Pleasure can become difficult to experience, but depression reaches much further. Sleep patterns can dramatically change. Appetite may increase or disappear. Concentration can become surprisingly difficult. Even simple decisions feel mentally exhausting. Your body may feel unusually heavy. Thoughts can become intensely negative too. Motivation may almost completely disappear. And unlike an ordinary bad day, these symptoms don't simply vanish tomorrow. A major depressive episode involves symptoms persisting for at least 2 weeks. They also significantly disrupt everyday life. Depression isn't simply extreme sadness. It can affect your entire system for motivation, energy, pleasure, and thinking. Bipolar disorder. Bipolar doesn't mean changing moods quickly. That's an extremely common misconception. The defining feature involves distinct episodes. During mania, something dramatic can happen. Mood and energy become abnormally elevated, or someone becomes extremely irritable instead. Sleep needs can decrease dramatically. Someone might sleep only 3 hours, yet somehow still feel completely energized. Thoughts may begin racing rapidly. Speech can become unusually fast too. Confidence may expand into grandiosity. Ideas suddenly seem absolutely brilliant. Plans become larger and more ambitious, and decisions can become increasingly risky. Someone might spend enormous amounts impulsively. They might drive dangerously or recklessly, or make enormous, life-changing decisions, things they'd never normally consider doing. Depressive episodes move differently. Energy can suddenly collapse instead. Pleasure may become difficult to experience. Thinking and movement can slow down. Bipolar I includes full manic episodes. Bipolar II works somewhat differently. It involves depression alongside hypomanic episodes. Hypomania is less severe than mania. So bipolar isn't random moodiness. It's distinct episodes significantly changing mood, energy, activity, and behavior. Obsessive-compulsive disorder. Imagine locking your front door, then walking towards your parked car. Suddenly, one thought interrupts everything. What if I didn't lock it? You clearly remember locking the door. You practically watched yourself doing it. But somehow the doubt remains. So you walk back and check. The door is obviously locked. For a moment, relief finally arrives. Then the doubt returns again. What if I checked it incorrectly? This captures part of OCD's cycle. Obsessions are recurring, unwanted thoughts. They can also involve images, urges, doubts, fears, or impulses. These thoughts create intense anxiety. Compulsions are attempts to reduce it. Someone might repeatedly check something. Others wash, count, arrange, or repeat. Some compulsions happen entirely inside thoughts. Others involve constantly seeking reassurance. The behavior temporarily reduces the anxiety. And that's exactly the problem. Because the brain learns something dangerous, apparently the obsession required a response. So when the thought returns later, the compulsion feels necessary once again, and the cycle becomes increasingly reinforced. That's why OCD isn't simply cleanliness. It isn't just liking perfect organization. Someone can have an incredibly messy room while experiencing severe obsessive-compulsive disorder. Post-traumatic stress disorder. Imagine surviving something genuinely terrifying. Eventually, the actual event ends. But your nervous system doesn't agree. It behaves like danger remains nearby. That's the central problem behind PTSD. Memories may intrude without permission. Nightmares can recreate parts of trauma. Ordinary reminders may suddenly become triggers. Maybe it's one particular sound. Maybe it's a familiar smell. Maybe it's simply visiting somewhere specific. Suddenly, the fear comes rushing back. Some people can experience flashbacks. Parts of the traumatic experience feel like they're happening again. Others begin avoiding anything connected to what happened in the past. The brain may remain constantly hyper-alert, always searching for another possible threat. Small noises can cause intense startling. Sleep may become increasingly difficult. But trauma doesn't automatically cause PTSD. Many trauma reactions gradually improve naturally. PTSD involves characteristic symptoms that persist and significantly interfere with everyday life. The original danger already disappeared, but the brain's threat response hasn't completely realized that yet. Attention deficit/hyperactivity disorder. Everyone becomes distracted sometimes. You unlock your phone for something, 20 minutes later you're watching videos. You forgot why you opened it. That alone obviously isn't ADHD. ADHD is a neurodevelopmental disorder. Its symptoms begin during childhood. They can involve persistent inattention, hyperactivity, impulsivity, or different combinations. Someone may repeatedly begin new tasks, then struggle to actually finish them. Important objects constantly seem to disappear. Deadlines can sneak up unexpectedly. Organizing everyday responsibilities becomes difficult. Other people show obvious hyperactivity. Remaining still may feel uncomfortable. Waiting can become unusually difficult. Words sometimes escape before thinking finishes, but ADHD doesn't mean someone is physically incapable of concentrating. Sometimes the opposite can happen. Highly interesting activities capture intense attention. Hours can seemingly disappear during them, yet boring responsibilities remain incredibly difficult. The issue isn't simply lacking attention, it's difficulty consistently regulating attention, behavior, impulses, and executive functioning. Autism spectrum disorder. Autism resists one simple stereotype, because autistic people can differ enormously. Autism is a neurodevelopmental condition involving differences in communication and social interaction, alongside restricted or repetitive patterns of behavior, interests, or activities. Someone might struggle interpreting social signals that other people process automatically. Facial expressions can require conscious interpretation. Tone of voice may be confusing. Unspoken social rules aren't always obvious. Another autistic person might communicate fluently, but constantly interpreting social expectations can still become incredibly exhausting. Sensory experiences can differ dramatically too. Ordinary lights may feel overwhelming. Certain sounds can become unbearable. Specific textures might cause intense discomfort. Unexpected changes can create real distress. Some interests become unusually intense. Someone may explore one subject deeply, much deeper than people around them, and that's why it's a spectrum. Not because every autistic person sits between mildly and severely autistic. Different characteristics can appear together in completely different combinations and intensities. Anorexia nervosa. Eating disorders aren't extreme diets, they're serious psychiatric disorders instead. Anorexia can involve persistent food restriction. There's often intense fear of weight gain. Body perception may become significantly distorted, and this creates a dangerous contradiction. Your entire body requires adequate nutrition. Your brain requires that nutrition too. When restriction becomes increasingly severe, concentration and thinking can suffer. Mood can become significantly affected. Hormones and other systems can change. Heart function can become dangerously affected. Yet gaining weight may feel threatening, so something strange begins happening. The behavior physically damaging the body can feel psychologically necessary to continue. That's what makes recovery complicated. And there's another important misconception. You cannot reliably identify eating disorders simply by looking at someone's body. Bulimia nervosa. Bulimia creates a different cycle. It involves repeated binge eating episodes. A person consumes unusually large amounts while experiencing powerful loss of control. It may feel impossible to stop. Then comes an attempt to compensate. That can involve self-induced vomiting. Some people begin fasting afterward. Others use excessive physical exercise. Certain medications can also be misused. Then the cycle can repeat again. And appearances can hide everything. Someone's weight might remain within a broad range considered medically typical, so people around them notice nothing. But serious complications can still develop. Electrolyte disturbances can become particularly dangerous. Bulimia isn't simply overeating and regretting it. It's a recurring psychiatric pattern involving eating, control, compensation, and distress. Binge eating disorder. This shares something important with bulimia. Both can involve recurrent binge episodes. Someone might eat unusually quickly. They may continue despite uncomfortable fullness. Large amounts might be consumed, even without significant physical hunger. But the central experience is control. During the episode, control feels lost. The person may desperately want to stop what is happening, yet stopping feels extremely difficult. Shame and distress often follow afterward. But here's the important difference. Binge eating disorder doesn't regularly involve the compensatory behaviors seen in bulimia, so this isn't occasional overeating. Most people occasionally eat too much. Binge eating disorder involves a recurring pattern of lost control and significant distress. Schizophrenia. Popular culture gets schizophrenia badly wrong. First, it doesn't mean multiple personalities. That's an entirely different misconception. Schizophrenia can involve psychotic symptoms. Perception or interpretation of reality can become significantly disrupted. Someone might hear voices, for example. Voices nobody else around them hears. Delusions can also occur. These are strongly held false beliefs maintained despite significant contradictory evidence. Someone might believe they're being followed, or secretly watched by other people. They might feel deliberately targeted. Thinking can become difficult to organize. Speech may become disorganized too. But movies usually emphasize these symptoms. They often ignore another important side. Motivation can significantly decrease. Emotional expression may become reduced. Social withdrawal can become increasingly common. These are called negative symptoms. They may look much less dramatic, but they can profoundly affect relationships, independence, and everyday functioning. Borderline personality disorder. Imagine emotions having a volume knob. Now imagine yours changes extremely quickly. A small sign of rejection can feel like everything is collapsing. Borderline personality disorder can involve persistent instability involving emotions, relationships, self-image, and sometimes impulsive behavior. Fear of abandonment can become intense. Relationships may feel extremely close, then suddenly become intensely conflicted. Someone's sense of personal identity can also change dramatically over time. Impulsive decisions can create additional problems. BPD is sometimes confused with bipolar, but they're not the same condition. Bipolar involves characteristic mood episodes, typically lasting days or much longer. BPD emotions can shift much faster, and those shifts are often connected to interpersonal events and relationships. Similar symptoms can appear outside, yet the underlying patterns differ significantly. Dissociative identity disorder. Normally, your memories and identity feel like one continuous personal experience. Your awareness feels connected too. Dissociation can disrupt that integration. Someone may feel detached from themselves. The world can suddenly feel unreal. Dissociative identity disorder goes much further. DID involves disruption of identity alongside recurrent gaps in memory. These gaps go beyond ordinary forgetting. Different identity states can involve changes in behavior, awareness, memory, or perception. Sense of self can change too. Hollywood dramatically distorts this condition. Movies often transform DID into dangerous personalities hiding inside someone. That's an extremely misleading stereotype. The disorder is strongly associated with severe and repeated childhood trauma, and the reality is far more complex than dramatic personality switches in movies. Substance use disorder. Using a substance doesn't automatically mean someone has a substance use disorder. The important issue is the pattern, especially when control begins breaking down. Someone repeatedly intends to use less, but consistently doing that becomes difficult. More time gradually becomes devoted to obtaining or using the substance, or recovering from its effects afterward. Responsibilities may begin slipping away. Relationships can become increasingly damaged. Yet substance use continues anyway. Even when the person recognizes the problems it's clearly creating, tolerance may also begin increasing. More becomes necessary for similar effects. Withdrawal symptoms can sometimes develop when regular use suddenly stops. Something that began as behavior can gradually become strongly prioritized by the brain's motivation systems, even while another part desperately wants the entire cycle to stop. But here's the important connection. These disorders look completely different. One creates seemingly endless worry. Another creates repetitive compulsive rituals. Another dramatically changes mood and energy. Another can alter eating behavior. Another can disrupt perception of reality. Yet they share one important lesson. A single symptom proves almost nothing. Everyone occasionally becomes anxious. Everyone sometimes struggles with attention. Everyone experiences strange, unwanted thoughts. Everyone has emotional ups and downs. Everyone sometimes behaves impulsively too. Mental disorders involve larger patterns. The specific symptoms matter. Their intensity matters just as much. How long they persist matters. The context surrounding them matters too. And most importantly, professionals consider how much they disrupt everyday functioning. So recognizing yourself somewhere here doesn't automatically mean you have the disorder being described in this video. Different conditions can share similar symptoms, and completely ordinary human experiences can sometimes resemble psychiatric symptoms. Diagnosis requires seeing the whole picture, because mental disorders aren't labels for strange or fundamentally different people. They're names given to recognizable patterns in how human minds can struggle. And perhaps the strangest thing is how ordinary their ingredients are. Fear normally protects you from danger. Attention helps decide what matters. Reward gives behavior, motivation, and direction. Memory connects your experiences together. Habits make repeated behavior more efficient. Emotion tells you what matters personally. Every healthy brain needs these systems. The difference isn't simply having them. It's what happens when their patterns become persistent, intense, and disruptive, and begin working against the person they were originally supposed to protect.